Good morning, good afternoon, good evening, ladies and gentlemen. Welcome to NAVA International live session on the occasion of World Hepatitis Day, July 28th. We welcome everybody from all around the world. Today with us is a very distinguished guest, Dr. Neha, who is joining us. She is a Ayurved expert, and I'm going to introduce her in a few. While we are waiting, Dr. Neha, for those who are going to join today in this live session, I would like to take this opportunity to thank you very much. We understand that you have a very busy schedule, and really thank you for dedicating this time to be with us in NAVA International. Also, for those who are very new to NAVA's live sessions or to NAVA in general, I would like to take this opportunity to take a couple of minutes to introduce NAVA and what we do here while we are waiting for others to join. NAVA International is the larger umbrella of NAVA in general as a NAVA holding. In NAVA, we offer a number of services, from offering yoga classes to meditation, from producing and supplying organic products to offering individual counselings and yoga therapy sessions. NAVA itself was established more than 3 decades ago. And now we are offering our services internationally to those who are interested all around the world. Dr. Neha, also, I would like to introduce you very briefly for the sake of time, but I know even briefly is going to be cannot be very brief, because we have done a lot and you have contributed a lot to the knowledge. Just in a few words, Dr. Neha is an associate professor at the Department of Panchakarma at Institute of Teaching and Research in Ayurved in India. She has been serving as the faculty member as well as many other at many other capacities for the past almost 17 years. She is a very popular speaker amongst international scholars, especially in Japan. Dr. Neha has offered more than 10,000 various Panchakarma procedures. She has been invited to TV talks in India on national TV, and of course, last but not least, in this long list that I have in front of me, I'm just picking up, she has published more than 25 articles in various peer-reviewed journals in international magazines and newspapers. Dr. Neha, thank you very much again for joining us here on the World Hepatitis Day, and the topic will be an Ayurvedic approach to hepatitis. Without any further ado, Dr. Neha, the floor is yours.
Namaste, everyone. Thank you for introducing me. I'm myself, Dr. Neha Modha. As already my brief introduction is given, I am working with the National Institute with Ministry of Ayush, and would be briefing about the hepatitis, the present scenario, and how Ayurveda can help in that, and what are the preventive aspects we can do in hepatitis. So without wasting much of the time, I would start with my presentation, a short presentation, and then we can go with our short discussion also. World Hepatitis Day is marked every year to increase awareness and understanding. 90 million people are living with viral hepatitis unaware. Without finding the undiagnosed and linking them to care, millions will continue to suffer and lives will be lost. On World Hepatitis Day, 20th July, we call on people from across the world to take action and raise awareness to find the missing millions. Hepatitis, over 3,000 people die every year. Timely testing and treatment, left untreated hepatitis, contaminated needles can transmit, ingesting contaminated food. These are the few things which we should be aware about. The risk factors which are involved in hepatitis are sharing needles, exposure to toxic chemicals, unsafe sex, not being vaccinated against viral hepatitis, unsafe drinking or washing water, having an autoimmune disorder. Before going into the detail of hepatitis, we should know about the functions of the liver. Just a brief, the main functions where liver is involved, that is the main detoxification. The drugs, whatever we take, alcohol we consume, the fatty acids, the steroid hormones, all are detoxified in liver. Production of cholesterol, it is a precursor to sex hormones, vitamin D. Storage for micronutrients, minerals, copper, zinc, magnesium, iron, vitamins A, D, E, K. All these are not possible because of the without liver functions. The metabolism, conversion of T4 to T3, immune system, protein synthesis. So you can just have an overall picture that such an important functions are done by liver. So it is a really vital organ which we need to protect. What is hepatitis? The basic term, that is the inflammation of the liver and most commonly caused by viral infection. We can classify the hepatitis into three, that is the infectious hepatitis, toxic hepatitis, and other hepatitis. Infectious hepatitis can be further classified into viral, bacterial, and parasitic. The toxic one we can classify into alcohol, drug-induced, or chemical hepatitis, and the other hepatitis under which falls the radiation, autoimmune, and the genetic. These hepatitis, the green ones which are ticked where the vaccines are available, the estimated cases worldwide of hepatitis B, C, the gradual death, the treatment, and how does the virus spread is shown in this slide. The simple symptoms through which you can reach to a little bit diagnosis that these are the symptoms of viral hepatitis, like reduced appetite, jaundice, fever, dark urine, pale poop, nausea and vomiting, pain in the right side of abdomen, digestive disorders of diarrhea, joint pain, weakness, and fatigue. Common complications of the hepatitis, that if you don't take timely treatment, or some of the hepatitis itself are so complicated that it may progress and disease becomes more complicated. Some of the disease like fibrosis and cirrhosis are very common. Fortunately, some of these complications can also be prevented with Ayurvedic treatments. Fibrosis, cirrhosis of liver, liver cancer, liver failure, kidney damage, brain damage, portal hypertension, porphyria, viral co-infection. When to see a doctor? This is again an important thing to understand for all of us, that timely consult a doctor. If you experience any of these potentially serious symptoms, you need to see a doctor immediately. Persistent vomiting for longer than 6 hours, extreme drowsiness, confusion or restlessness, unusual bruising or bleeding, or if jaundice continues for longer than 3 weeks. Diagnosis and symptoms of viral hepatitis. The lab diagnoses are available, that is demonstration of virus in feces, virus isolation, detection of antibody by ELISA test, biochemical tests about bilirubin, ALT, protein, and molecular diagnosis by RT-PCR of the feces. How to protect yourself against the various forms of hepatitis? You can get yourself vaccinated, get yourself tested. If you are pregnant, ask a doctor how to protect your baby. Peel fruit and vegetables, cook properly. Only drink clean and boiled water. Wash your hands regularly. Use clean razor, blades, and sterile syringe, and never share. Use condoms and put them on correctly. Now, with a brief explanation about what is the hepatitis, we come to the what Ayurveda has to contribute in hepatitis. Ayurveda, the liver is called yakrut. The term, so it is a Sanskrit term, and pith is the dominant humor of the liver, because the main functions of the liver are governed by pitta. This is one of the biohumor as explained in Ayurveda. In Ayurveda, it is said that our body is governed by three biohumor. One is kapha, one is vata, and third one is pitta. So in liver, the main biohumor or dosha, that is known as pitta. Most liver disorders are aggravated conditions of pitta. Excessive bile production or blockage in the flow of bile usually indicates high pitta, which in turn affects the agni or enzyme activities responsible for absorption, digestion, and metabolism. Aggravation of pitta causes the liver disease such as hepatitis, cirrhosis of liver, or fatty liver. Kamla is the term mentioned in Ayurveda to describe the wide range of liver diseases, which also includes hepatitis. Because in Ayurveda, where the terms go more towards the Sanskrit side, so we won't get the term hepatitis. The term is used as a Kamla, under which the group of diseases affecting the liver are covered. So again, when we go into the detail, it is said that this disease Kamla, as described in Ayurveda, it is the disease related with the channels of the blood, that is Rakta Vahasrotas, which includes organs such as liver, spleen, blood vessels, reticuloendothelial tissues, and dominant of Pitta dosha. Kamla is caused due to impairment of Pitta dosha and Rakta Dhatu. Dhatu, that is tissues. Ayurveda describes various types of Kamla, that is hepatitis or jaundice, based on the stage or depth of the symptoms. They are four, that is Shakha Ashrita. It is caused by the aggravation of all the three dosh, which I now just said, that biohumors, all the three. Involvement of Vata is there, Pitta is there, and Kapha. And it is a kind of obstructive jaundice, we can say. Or Koshta Ashrit Kamla, that is result from very high pitta derangement and considered severe jaundice or hepatitis, which is difficult to cure. Kumbha Kamla is a neglected or untreated stage of jaundice or hepatitis. It becomes incurable if not attended immediately. It can be compared with the cirrhosis of liver. Halima is an advanced or neglected stage of Pandu Rog that occurs when both Vata and Pitta are out of balance. That is, the Pandu Rog is a type of anemia which is covered under Ayurveda. So when you neglect anemic conditions as well as the disease which worsen the liver, it goes into the Halima disease. So these are the different four diseases which are described under the heading of the Kamla. Then comes the causative factors. An anemic person has more intake of bile. If you are suffering from anemia and still if you are keep on indulging in the diet and the regimen which aggravates more pitta in your body, then pitta becomes more vitiated. Such things are, and also like intake of alcohol, excessive intake of dry, sour, cold, heavy, sweet, and unwholesome food. Exercise and suppression of natural urges. Types, mainly two types of jaundice are described that I already described, and pathogenesis, both are having mainly the different pathogenesis. We can't go in detail because here it is not needed about the pathogenesis. Mainly the identification of the symptoms of jaundice which occurs in the extremities and viscera is important. That is, the color of nails, skin, face, and eyes becomes similar to turmeric, that is the haridra. The color of urine and stool is like pitta mixed with the blood. The whole body becomes greenish in color like a frog. These are the comparative colors given in the Ayurveda Samhita. The comparisons are given to animals and birds. Senses are not able to perform its functions properly. Burning sensations, indigestion, weakness, looseness in joints, and loss of appetite. Hepatitis, about the treatment, line of treatment indicated, that is, two line of treatments are indicated. One is the drug induced purgation, and the second one is followed by internal medicines. So these are the probable two treatments which one can offer for the hepatitis patients. Now, about the drug-induced purgation, this covers mainly the purification of the body. It is termed as the Virechan Karma, and the main humor involved in the liver disease is Pitta. Out of the 5 elimination therapy, that is Panchakarma, purgation is the best for elimination of Pitta. So here the dosh which is involved is Pitta, so we select this therapy among the 5. These are the different suggestions about the how you can go for the purgation. Mild purgation, you can go with the milk and cow's urine, only milk with the Belliospermum montanum fruit. Belliospermum montanum fruit, that is Danti, and Draksha, that is Vitis vinifera, Terminalia cebula and cow's urine, Belliospermum montanum root and jaggery, soft pulp of Cassia fistula with Zanzibar officinalis, black pepper, and pipli. These are the different combinations given in our Sanhita for mild purgation. If one requires to go with the proper classical purgation, that is the drug-induced purgation, it is a quite detailed procedure which covers pre-procedure, main procedure, and post-procedure. The pre-procedure itself covers 5 days, the main procedure covers 1 day, and the post-procedure covers again the another 5 days. So it is quite time consuming, but it is very useful for the detoxification of the whole body, and especially for the elimination of the vitiated pit, which is the main involvement in hepatitis. And it is also good procedure for detoxification or functioning of the liver. We cannot go in the detail of each and every procedure about pre, main, and post procedure in Virechan, because then again it may cover 2 to 3 more lectures. These are the some internal medicines, because there are patients also who cannot undergo this detoxification procedure. So we can also go with the only internal medicines, or it could be like doing the detoxification, and after that we can go for some internal medications. So these are list of some of the internal medications which are suggested, like powder of Terminalia cebula, powder of Terminalia cebula mixed with the cow's urine or mixed with the jaggery and grita. You can mix also with Terminalia bellerica, Umbilica officinalis, and with the juice of Umbilica officinalis. Some more combinations are also suggested, that with this combination you can also add iron ash, that is known as the Loho Bhasma in Sanhita. And with this combination, you can also add Berberis aristata, Picrorhiza kuru, and all powders can be taken with honey and grita. These are the list of some of the internal medicines, that is the Katuki, because it is the main drug known as Picrorhiza kuru, which have shown that it increases the gallbladder shrinkage, and this Ayurvedic drug helps in digestion of by curing liver ailments. It can be also consumed every alternate day for fast recovery. Karl Mager, that is Andrographis paniculata, this is also an Ayurved remedy known for the liver diseases. Other drugs like Bohairavia diffusa, Terminalia cebula, these are also known for the proper functioning of the liver as well as for the spleen. These are the other list of the drugs, that is the Bringraja. It is helping in reviving the liver cells and clears the toxins from the body. This Chikori, that is Kasani, is considered to be a miraculous drug owing to its ability to revitalize liver and kidney. Bruhati, that is the Solanum indicum, it has the ability to counter alkaline phosphate that damages the liver. Some also polyherbal formulations are available, like Abhayarishta, Rohitarishta, Kutajarishta. These are the herbal formulations. We get it in the market easily and we prescribe them. These are the diet suggestions, that is the beneficial diet you can incorporate, that is whole wheat, barley, Oryza sativum, that is a type of rice is there, plenty of raisins, juice of Umbilica officinalis in food and water, meat soup of the animals which are residing in the dry region, different types of legumes, it's soup. These are the suggestions for the diet. And of course, the non-beneficial diet, it includes the one which aggravates the pitta in your body, the oil cakes of sesame oil, and sour and salty food and heavy food has to be avoided. So just I conclude with a brief description about the hepatitis and what Ayurveda has to contribute in this. We can now go with a little bit discussion, and I just complete my slide sharing here. Thank you for patience hearing.
Thank you very much. Thanks, Dr. Naji. This was very, very informative, and I personally learned a lot. I think the slides were very, very rich and a lot to learn, of course, in this slideshow. Dr. Naji, I have, of course, a number of questions that I personally would like to ask, but also I'm pretty sure there are a number of questions that our audience or those who are going to watch this recording later may have. I would like to start with a burning question, and that would be, you mentioned a number of treatments as a Ayurveda approach to treating, basically to manage those who already are diagnosed with different types of hepatitis, or they know that somebody is. So is there a hope that Ayurveda can help these people in, and if yes, in what extent do you think Ayurveda can help these people?
Yes, this is a good question, because many people have a problem that though they come out from the hepatitis, the recurrences are there. Some of them, they are treated properly, but they cannot come back to the normal of digestion, routine activity, bloating, all these problems are persisting. So in such cases, when they are in the acute phase or when it is the beginning time, they may take the allopathy or emergency treatment as and when required. But after that, they can shift towards the Ayurveda, and we can suggest some of the drugs like Katuki, now only I told you, or Kalmeka, such type of drugs, Terminalia, Chebula, they can take it as a part of their daily routine, or before shifting to the drugs purgation, there also you can suggest them as a one-day instant or an immediate purgative process, like taking a purgative drug for 1 day on empty stomach and leaving on just hot water for whole day, and taking only vegetable soup or the soup of the legumes next day. That would also help to stimulate their liver functions. So shifting to some of the Ayurveda drug and doing little bit of a detox or purification would help them to come out from all this. But of course, they should take a proper guidance from someone who is known about these procedures of proper Ayurveda doctor, so they can go on a proper line of treatment and they get good results for themselves, of course.
Absolutely. So it looks like, from what I hear, getting consultation from an Ayurveda expert is extremely important, because I understand that based on what you mentioned, it's a case-by-case so I think you cannot necessarily prescribe something to all different, which just takes me to my next question, and that is different types of hepatitis. Hep A, you mentioned, Hep B, C. Are these drugs or the procedures that you mentioned, are they the same for all of these, or they are different for different types of Hep?
No. The procedure, what I explained about the purgation or detoxification, that would be the same for all. But just you might have noted in the slides, some drugs were specific which were effecting for rejuvenation of the liver cell. Some were there which were contracting gallbladder. Some are there which are more improving the functions of the liver cell. So when you select the drug, that time you have to be careful which type of hepatitis you have. And that's why only I told, like, this is the problem. People get an information and they think that any drug we can take it for the function of the liver, which is suggested means in by someone. A proper guidance whenever you are taking into stimulate the bladder. Are you in a state of the rejuvenation of the cell? Accordingly, the internal drugs would be changed. The purgation process will be same for all.
All right, thank you. It's just like there is a slight internet connection problem, or there's a lag in your voice. My last question, because for the sake of time, we need to wrap up, Dr. Naji, and that will be the preventive measurements. What is Ayurved's approach as preventive measurements for different types of hepatitis?
Yes. Ayurveda has always emphasized on the preventive aspect, because whenever we study in Ayurveda, we are always taught that the first is the prevention, that is explained with swasthya rakshanam, that is to protect the health of the healthy person. And this is the main aim of Ayurveda. And the second line is always taught that now you have to treat to the patient. So the first aim in Ayurveda is always preventive. And when it comes to hepatitis, the main prevention aspect is to do the cleansing of your body. Though you cannot go for the direct purgation process of this 15 days classical type of thing, but at least you can take a proper purgative medicine for every 15 days, or if it is not possible 15 days, you can take any of the purgative medicine once a month. Take a proper purgative medicine, so that will cleanse your intestine, that will stimulate your liver. At the same time, followed by that purgative medicine, you can go for any type of the process like this abstination from the food, and living on only hot water or some soup or such type of the thing for just one day. So that would be very simple procedure, and that would stimulate all your digestive functions, and especially the liver function. In India, we have all these type of the things which are merged in religion thing under the term fasting. So automatically, like once in a week, once in a 15 days, when we do proper fasting, it is stimulated, and we can prevent many such diseases. And especially when there is seasonal change. So when it is a time of seasonal change, that time you should do these type of procedures, and these are really very beneficial. It is just a simple process of taking purgative drug at one night and taking only hot water of soup another day. So whenever you have a leave or you can take a break, that time you spare one day for yourself. And specifically during seasonal, when seasons are changing, that time when you do, then these are very beneficial. If you cannot do things, then just a fast every 15 days. And fasting means it has to be a proper fasting of warm water or light diet. So that is beneficial and a preventive aspects, especially for hepatitis prevention. And yes, sorry, one more thing regarding the diet also. When you indulge into the diet, try to avoid the food which are heavy to digest, fast food type of things, or food taking late night food. And when heavy foods or the food which is difficult to digest or taking long time for digestion, such foods are to be taken only once in a week. Repeatedly, if you take such foods, then the liver is damaging. Sometimes if you take, like just some people take alcohol sometimes, then it is not that much harmful relatively, those who are taking daily. So same way with the food also, if you check yourself, then prevention would be there.
Wonderful. Thank you so much again, Dr. Naji. Thank you very much for your time. We really understand that you have a very busy schedule and really appreciate the time that you spent today on the occasion of the World Hepatitis Day, July 28th. We look forward having more informative sessions with you here. And for those who were not able to join us today live, we are going to make this live, the recording available on both pages, and we look forward to receive people's comments also. Thank you again, Dr. Neha. If you have any closing remarks, please.
Yeah, thank you very much. I would like to thank No International for giving me this opportunity and sharing my thoughts of Ayurveda on hepatitis. And I would like to spread the thoughts of Ayurveda more and more to the people. Thank you very much.
Absolutely. We also are very delighted to have you and looking forward for more sessions. Thank you very much. Thanks to all the viewers who could join us today. And we are, as I said, going to make this recording available for later use. Have a wonderful day. Bye.